welcome to the deep dive. You send us resources, and, well, we dig into them to pull out the essentials for you.
Exactly. And today we're tackling Chapter 4 from the Saunders Comprehensive Review for the NCLEX-PN Examination, the 7th edition.
Right. It's all focused on test-taking strategies.
Our mission here is pretty straightforward. We want to arm you with really solid, effective ways to approach your nursing exams, especially the NCLEX-PN.
And this chapter, it has some pretty unique features, doesn't it?
It really does. Things like strategic words highlighted in bold.
Yeah, I saw that. And the blue highlighting for the actual test-taking strategy being used.
Mm-hmm. And then magenta for the specific content areas you might need to brush up on right within the practice questions.
That's like a built-in study coach, kind of. Very clever.
It is. And they also mention, if you want to go even deeper, the Saunders Strategies for Test Success book, another great resource.
Okay, so lots to cover. Where do we start? Maybe those key strategies in box 4.1.
Good place to start. The absolute first thing, you have to focus on the data, the information in the question.
Read every single word, basically. Don't skim.
Definitely not. Figure out what they're really asking. And tied to that, you got to identify the subject. What's the core topic here?
What content are they testing? Knowing that helps narrow things down, right?
Absolutely. And then try to visualize it. If it's a clinical scenario, picture it. What's going on?
Are there, like, weird details, abnormalities?
Exactly. Those little abnormal bits of data can be huge clues.
And those strategic words we mentioned, the bold ones.
Crucial. Words like first, best, immediate, initial, they totally shape what kind of answer you're looking for.
Yeah, it's not just any correct answer. It's the most correct or the first thing you'd do. Big difference.
Huge. And you also need to figure out if it's a positive or negative question.
Okay, explain that.
Well, a positive one asks for the correct statement, the right action. A negative one often uses phrases like needs further teaching or least likely. It's asking for the incorrect option among the choices.
Ah, okay. So you're looking for the mistake or the misunderstanding in that case.
Precisely. And always think about everyone mentioned. Usually the client, of course, but sometimes family members are involved. Think client-centered, family-centered care.
Right. And if it's a communication question?
Therapeutic communication is key. Focus on the client's feelings, their concerns. What are they really saying?
Got it. Now, this next one seems important, avoiding reading into the question.
Oh, definitely. The book calls out those forbidden words. Well, what if?
Yeah, we all do that. We start adding details that aren't there.
Exactly. You absolutely have to stick to only the information given. Don't invent scenarios.
Okay, so stick to the script, literally. What about the answer choices themselves?
Always use the process of elimination, even if you think you know the answer right away.
Go through the others and figure out why they're wrong.
Yes. It confirms your choice and catches potential misunderstandings.
Smart. And what about options that look really similar?
That's a great tip from the chapter. If 2 or maybe even 3 options say basically the same thing, just phrased slightly differently, they're probably all wrong.
Interesting. So look for the unique, correct concept.
Right. Or look for the umbrella option.
The umbrella option.
Yeah, it's like a broad statement that kind of covers the main idea of several other more specific options. Often, that broader statement is the right answer.
Okay, I can see that. Like a general principle.
Watch out for closed-ended words.
Like all, always, never, only.
Exactly. Those absolutes. Nursing is rarely black and white like that, so options with those words are often incorrect.
Look for the more open-ended words instead. May, usually, sometimes.
Generally, yes. They allow for more nuance, which is common in healthcare.
Okay. Now, prioritization. That's huge on the NCLEX, right?
Absolutely massive. You'll see tons of these. The key frameworks the chapter highlights are, first, the ABCs.
Airway, breathing, circulation, standard stuff.
Standard, but critical. Usually in that order, unless it's active CPR, then it flips to C A B circulation first.
Good distinction. What's next?
Maslow's hierarchy of needs. Remember that pyramid? Physiological needs, first food, water, oxygen, that stuff. Then safety, then love and belonging, and so on up.
So basic survival needs trump everything else.
Pretty much. And the third big one is the nursing process itself.
Data collection, planning, implementation, evaluation, ADPIE, or sometimes just API right for the PN.
Right. The chapter really emphasizes using these steps to prioritize. If a question asks for the first action, it's often data collection, assess, check, monitor. Those are your clue words.
Unless it's an emergency, maybe.
Exactly. Sometimes immediate intervention based on the ABCs might come before further assessment in a crisis,
Yeah.
but generally data collection first.
Makes sense. The chapter dives deeper into some of these, right? Like avoiding reading into the question in box 4 too.
Yeah, it really hammers home sticking to the facts. That what-if thinking just leads you down the wrong path.
And it uses that tracheostomy example, doesn't it? Tube dislodged. What's the initial action?
Right. The strategic word is initial. Employing ABCs immediately points to ensuring ventilation. Don't overthink. Deal with the immediate life threat.
Clear example. Then box 4.3 talks about the ingredients of a question.
Breaks it down into 3 parts. The event, that's the client situation, the event query, the actual question being asked, and the options, your potential answers.
Analyzing each part helps you understand it better.
Definitely. And it covers the different types of questions, too, not just multiple choice.
Oh, yeah, like the multiple response, select all that apply ones.
Right. The chapter suggests tackling those like a series of true-false questions for each option.
That's a good tip. And ordering questions, fill in the blanks.
Figures, audio, video clips, charts, exhibits, you name it. With charts, the key is pulling out what's relevant and ignoring the distractors.
And those longer case studies or testlets.
Look for the abnormalities in the initial scenario. That often points you in the right direction.
There's an iron deficiency anemia example used here too, right? About taking iron supplements.
Yeah, it shows how the strategic word best guides you. Cola and soda are similar, likely wrong. Water's okay, but tomato juice provides vitamin C.
Which helps iron absorption, so that's the best option. Connects the dots.
Exactly. Then boxes 4.4 and 4.5 go deeper on those strategic words.
The prioritizing ones like best first, and the data collection ones like assess, check.
Right. It emphasizes that those data collection words usually mean the first step of the nursing process.
Like in the COPD example, client short of breath, what's the initial action?
Assess their respiratory status first. Gather data before you jump to interventions.
Makes sense. Then box 4.6 is about identifying the subject.
Yeah, just really nailing down the specific topic. What's this question actually about? Helps you weed out irrelevant answer choices.
The example was about infection prevention for an immunocompromised client. So options not related to that specific goal for that specific client are probably wrong.
Precisely. Then you have the positive and negative event queries again in boxes 4.7 and 4.8.
Positive asks for the correct info, like the postpartum bathing example.
And negative asks for the incorrect statement, often looking for a need for further teaching. Like the lithium example, which client statement shows they don't understand the home care instructions.
You're looking for the error in their understanding. Got it.
And then back to prioritization again, gets a lot of focus.
As it should. So it revisits ABCs, Maslow's, and the nursing process with more examples.
Yep, really drills them down. ABCs with the chest pain patient needing oxygen first. Maslow's with the rape victim where immediate safety is the priority.
And the nursing process broken down step by step.
Right. Data collection for the diabetic teaching program, assess needs first. Planning for the TB patient airborne isolation is the priority plan. Implementation for the range of motion exercise, how to do it safely. And evaluation for the radiation therapy skincare, did the client understand the teaching? Often a negative query there.
So, data collection first, unless urgent. Planning focuses on actual problems over potential ones. Implementation is about the nursing actions you can take. And evaluation checks understanding or outcomes.
You've got it. Then box 4.15 talks about spotting abnormalities.
If something's clearly wrong in the scenario data,
you usually need to do something about it. More assessment or an intervention. Just documenting or monitoring an obvious problem is rarely the right first step.
Like the digoxin example with the low potassium, that needs action.
Exactly. Which leads nicely into box 4.16, focus on the data.
Pay attention to those specific numbers, lab values, assessment findings.
Yes. And usually, if data is meant to be seen as abnormal, it will be clearly abnormal, not just borderline, unless there's a reason given.
Like the HbA1c of 10% example for the diabetic patient. That high number has to guide your teaching choice.
Absolutely. And running through all of this is the principle of client safety.
Always ask, could this option harm the client? If yes, eliminate it.
That's a fundamental check for every single question.
The chapter then touches on the main NCLEX client needs categories. Like
briefly, yeah. Safe and effective care environment. Think safety, infection control, delegation, physiological integrity, the body, meds, ADLs, using ABCs and Maslow's, psychosocial integrity, mental, emotional health, communication, coping, And health promotion and maintenance teaching, prevention, growth, and development.
And it links strategies to these, like therapeutic communication for psychosocial.
Exactly. And using teaching principles for health promotion, watching for those negative queries and teaching questions.
Okay. Then it revisits some strategies with more examples, like eliminating comparable options.
Right. Box 418 uses that post-op bypass example.
Yeah.
If several options are just different ways to assess pain, maybe the real issue is something bigger, like graft occlusion, hinted elsewhere.
And eliminating those closed-ended words again in box 419.
Reinforces avoiding all, always, never. Uses a pre-gastroscopy question as an example.
And the umbrella option gets another look in box 420.
Yeah, with the pacemaker example, the broad advice about avoiding strong magnetic fields covers the specific examples in other options.
Makes sense. What about box 421 on delegation? That's tricky.
It is, but crucial. Focus on the task, the client stability, and the scope of practice. UAPs for non-invasive tasks, LP&S, LVNs can do more, including some meds and stable patient care. RNs can handle assessment, planning evaluation, teaching, unstable clients, IV meds.
And remember, the Nurse Practice Act and national standards, not just what your hospital might allow.
Critical point. The NCLEX tests national standards. The example uses an LPN and UAP assignment to show how you differentiate tasks.
Okay, nearly there. Box 422 is on pharmacology questions.
Yeah, some good tips here. Use what you know, look for the generic name, try to identify the drug class that tells you a lot about actions and side effects.
Relate the nursing interventions to potential side effects.
Exactly. And really focus on what the question is asking. Is it about the intended effect, a side effect, an adverse reaction, a nursing action?
And those pharmacology pyramid points seem like good rules of thumb.
Definitely. Things like not crushing certain pills, clients not adjusting their own doses, avoiding alcohol, checking interactions, basic safety stuff.
The at the roll example shows applying these ideas.
And that pretty much wraps up the core test-taking strategies from Chapter 4.
So that leads into the intro for the next unit, Unit 2.
Right. It briefly introduces professional standards in nursing. It signals what's coming next.
Things like cultural sensitivity, ethics, legal stuff, client rights, advocacy.
Documentation, advanced directives, coordinated care. It flags the importance of culturally competent care, especially with increasing diversity, avoiding stereotypes, understanding different needs.
And mentions the Nurse Practice Act, confidentiality, informed consent, all that foundational professional stuff.
Plus the role of technology and how nurses coordinate care with the whole team.
And it lists the learning objectives for Unit 2 under the client needs categories.
Yeah, it just gives you a heads up on how those professional standards concepts will weave through discussions of safe care, health promotion, psychosocial, and physiological integrity in the next section.
Okay, wow. That was a really thorough deep dive into those test-taking strategies.
It's a dense chapter, packed with useful techniques, from dissecting the question itself, using those strategic words,
to applying the big three, ABCs, Maslow's nursing process,
and all the elimination tactics, focusing on data, and always prioritizing safety.
These aren't just tricks, are they? They're ways to systematically approach the questions.
Exactly. They help you think clearly under pressure and apply your nursing knowledge effectively. The key is to practice using them.
So the final thought maybe is, knowing the nursing content is step 1, but mastering how to answer the questions is step 2 for success.
Couldn't have said it better myself. Definitely check out those Saunders resources if you want even more practice with these strategies.
Great advice. Thanks for breaking all that down. And thanks to you for joining us on the deep dive.